Okay, everyone, welcome to the fourth episode of my Keep Them Guessing podcast. I did want to really quickly explain why I keep them guessing, just so it's clear. First of all, that's been my tagline since day one. I patented it a long time ago, trademarked it because plastic surgery should always keep people guessing. There should always be a mystery. Did he? Did she not? What did she do? If it's obvious what someone had done, I think this plastic surgery can be questionable as far as its class, taste, and efficacy. So keep them guessing goes alongside with that philosophy I've always had to keep things natural. And there are sometimes people request a designer, what I say designer couture look, but in general, most plastic surgery, aesthetic surgery, skincare should be keep them guessing and a mystery. Secondly, if you look at the logo itself, take a look. We spent time revising this logo. You see that there's a DNA coil in there as well as a scalpel, because where the two merge is what fascinates me the most, which is wellness. I hate the term biohacking now, but I guess we can use it. Biohacking, wellness, true health inside and out, comprehensively, holistically. And the outside work that I do as an aesthetic plastic surgeon in Beverly Hills, California, also translates to internal changes. Now, today's episode, we are going to talk about rhinoplasty. Those of you that followed me know that I have been interested in rhinoplasty, believe it or not, since I was 8 years old. I went with my own mom to a consult back on Doheny and Sunset intersection in the tall building that's still there today, and went and visited with a legendary surgeon back in the day named Maury Parks. Now, just going into that office, having conversations with my mom, and her being an artist, painting and seeing her paintings in the house, inspired me to create. And the creativity came to me in the form of guitar playing, a little bit of art and sculpting, and later aesthetic plastic surgery. So rhinoplasty to me, especially with my ethnic background, is quintessential. Many patients in my old country and now here, 16, 17 years old, get it as a graduation gift. They get it as a birthday gift from the family. Sometimes they make the patient or teenager pay for it themselves through credit, but that's a whole different story. So an essential thing in plastic surgery is really the center of the face, and rhinoplasty is smack dab in the middle of your face. It's very, very important and critical. We should get into the history of rhinoplasty in a little bit. Let's do that now. So if you look, we can divide the face into fifths. We can divide it into thirds. I don't know many surgeons actually do these measurements anymore, but once you've trained and you know this, it becomes innate. It's kind of like riding a bicycle. You just kind of know. Just like sometimes you can drive a car and it doesn't matter if the road is, I was about to say the nose is wide. It doesn't matter if the road is wide or narrow. You know, because you've driven a car for 20, 30 years, how to adapt to those changes, even when you go to uncharted roads and territories. I drove once in Ireland. The roads were like this narrow, one road, and I had to drive on the left side, and it was fine to me because I race cars and I drive a lot. So for me, it was just that, like that, learning the game in Ireland to drive properly. Same thing with rhinoplasty. If you know the evaluation properly and you're a true rhinoplasty expert, you should be able to handle any nose that enters your practice doors, no matter what ethnic portion of the world they come from. Now, these measurements are important, but more importantly is that innate understanding and being able to execute a balanced nose on that person's face. Next, after proper evaluation and analysis, comes the conversation with the patient. It is so essential to have an in-depth conversation at least twice, if not 3 times, about their goals. I try to hone in on the top 3 goals for each patient. Then after that, the rest becomes the dessert, the gravy on top, the cherry on top, if you will, and the more nuanced, finesse little tweaks we can make. But the essential 3 goals are very important, especially in a revision, which is a whole nother topic I'll do a podcast on next time. So for rhinoplasty, especially if someone comes from a part of the world where their nose has to balance with their face, you want to have a conversation about certain things that might change or make them look ethnically incongruent or ambiguous. Some people want to retain their hump. Some people don't want to bring their nostrils in a lot or at all. Some people want to retain a little bit of the shape of their nostrils. They just want mostly tip balance along with a new bridge. One of the best examples of this is anybody who has African ancestry. They tend in general to have a dorsum or bridge that's a little bit lower and wider. Not everybody wants a tall bridge, or some people want 4 to 5 millimeters, or some people want what's called the radix only filled in and not the entire bridge height. They don't want the nose to be elongated forward. In this patient here, you can see we had specific goals. She wanted a fairly significant advancement and projection of her bridge as well as her tip. And one of the key things with someone like this is you have to know what to do with the nostrils. You got to rearrange the cartilage. You have to bring in new cartilage sources to lower those nostril rims to have nasofacial balance, dorsum tip balance, as well as alar tip transition, contour, and smoothness and balance. These balancing acts that we do in rhinoplasty are dynamic. One of my mentors, Dr. Bahman Gairon, talked about the dynamics in rhinoplasty as early as the 80s and 90s about how you make a change to the bridge. For example, if you bring a bridge in or you widen the nose, the eyes look further apart. If you bring the bridge forward and you bring the radix, this part right here, forward a fair amount, the eyes look closer together. These are dynamic changes. We didn't do anything to the eyes, but it adds nasofacial balance in general. So the nose is so critical and essential to the center of the face in that, no matter what the ethnic background is. If you deal with someone of Asian ancestry, you want to actually talk about how much projection. By and large, most Asian countries, the skin is very, very elastic. So you have to do extra cartilage addition to get that response. So if, let's say, I want a 5 millimeter change here, sometimes I have to add 9 millimeters of cartilage, counteracting that change. These are things that you can't necessarily read in textbooks. You just have to know about it and experience it and understand that artistry that interplays with the scientific evaluation and the background of knowing what techniques in your toolbox you need to bring out. Next patients are, and these are all in my textbook, is the Hispanic or Latina or whatever nose you want to call it, but essentially countries that originate from Spain, Portugal, and then also there's a mix with indigenous tribes, etc., in the Mayan, Inca tribes of Peru, all along South America, all the way up to California. You have such a mix. So we call the Castilian nose basically a nose that looks slightly Middle Eastern. Why is that? Because the North African Arabs and Persians were actually in the south part of Europe for so long, and obviously they weren't just talking. They were probably intermingling a little. So there's some mix of genetic ancestry there. So the nasal hump that a lot of the Latinas and patients in that part of the world have, you can thank my ancestors and some of the Arab ancestors for, and that's what it is. Mestizo noses are kind of in between that. You have wide nostrils, you have a little bit of a flatter bridge, but you could have somewhat of a hump. If you look in Peru, some of the patients there that come for rhinoplasty actually have a significant hump. And then you have what we call the chata nose, which is a term to talk about the thick, very sebaceous, oily skin that needs, similar to Asian ethnicities, needs a lot of cartilage to make a change. The more you have to do to the nose, the more the unpredictability. That's why, in my opinion, being able to operate on any type of ethnicity around the world in rhinoplasty is a very, very specific subspecialty expertise of rhinoplasty overall. Now, for chata noses, a lot of times you have to bring in rib cartilage, just like you have to do for a lot of noses that come from African ancestry. You have to bring in cartilage. Why? Because there's not much of a bridge, which translates to not much of a septum. The septum, the middle wall between the right and left side of the nose, where behind it there's a communication. Little side note, when a magician's doing this trick, there's nothing special they're doing. They're just passing that yarn or scarf behind the septum, and they're able to do this, and it looks like they're doing something magical, but there's a communication there way back in the throat behind the septum. That septum wall has a very small portion of cartilage, and in patients that don't have a tall bridge, it's even smaller. So you have to bring in sources from sometimes ear, sometimes and most often rib cartilage. You could use cadaveric rib cartilage now that's tissue banked, carve it, sculpt. You can see how this is getting complicated. Just me talking about this is making me tired because we know rhinoplasty experts have so much work to do to make a nose look natural and give the changes a patient desires. Now, the next patient, Middle Eastern population. Now, it's a misnomer because, for example, Iran or what used to be ancient Persia is actually Near Eastern. So if we want to get very semantic with it, it's a Near Eastern country. But in general, when we talk about Middle Eastern and Many can argue the Indian tribes or more Eastern, Middle Eastern, or Eastern areas of Asia, South Asia, in India, Pakistan, a lot of them actually immigrated from the Iran Persian area, and at that time, the Persian Empire. So that's why a lot of Indian patients look a little Persian. And then you have South and North. It gets very complicated. But the important thing is here that you have a spectrum there, very similar to what you do with the Hispanic Latina communities, where you have the wider, more Gulf Arab type noses that can be kind of thicker skin, and they have nostrils that are a little higher, not a lot of support, and then a bridge that needs to be possibly built up a little bit. And so you have more work cut out for you in those patients, whereas sometimes you have the spectrum more like my nose, where it's a little thinner skin. You can kind of see the cartilage here. If you zoom into my nose, and we'll actually do that for you right now. Ready? So I don't know if I trim my nose hair, but I'm putting myself on the spot here. You can see my cartilage. You can see the asymmetry. We all have asymmetries on our nose because guess what? The middle of the face is just an opening in the skull. The nose is basically a suspension bridge, like the Golden Gate Bridge, or some structure that you're literally suspending in midair, attached to bone up top, and then attached around here with ligaments and different structures, and that can cave in every single breath you take. So that structure is asymmetric because their skull has what I call scoliosis. Just like we have scoliosis in our spine, we have scoliosis, a term I came up with 2 years ago that people seem to love, and it really helps explain it. I get a chuckle with patients all the time, but I want people to know that asymmetry is normal. The most common variation is that I think about 80–85% of people, your left side of your face is your narrow face and rotated up. So it's a smaller face. And that's one of the theories why I think cleft lip palates, where you get an incomplete fusion, happens on the left. It's kind of like God or our creator's work is kind of towards the end. He's just finishing up real quick. It's the end of the day, or he has senioritis. He's about to graduate, done in the fetus. And he's like, just finish up real quick. And sometimes the coffee break takes too long and you get a cleft lip palate. But the left nose and left side of the face tend to match. You have a smaller dimension, narrower, and that way the whole is rotated up. So you can never, ever achieve perfect symmetry in any surgery we do, especially with rhinoplasty and particularly with breasts, where you can look at two structures in the mirror at the same time, simultaneously, your nostrils, your tip, your cheeks, etc. So going back to the Middle Easterns. So in Middle Eastern, and you can see in this, it's near and dear to my heart. I wrote a few chapters on this, a few articles. I wrote an expert commentary along with one of my mentors, Rod Rorick, on Middle Easterners. And I wrote in there exactly how you have to even have the consult, because I know this so well. It's not uncommon for especially teenagers or young females, even into their 30s, to bring their mom into the consult, and sometimes the whole family, the sister, the father. I feel like I should serve them ghormeh sabzi and tea and not even do a consult, but we end up talking about the daughter's nose. Very, very common. This happens in other parts of the world too. And honestly, that's what makes our job so fun, is because I can operate in the morning on a 9-year-old kid's otoplasty and pin his ears back and help him not get teased and bullied in school. And I can operate in the afternoon on his sister's, 17-year-old sister's rhinoplasty, and then next week his mother's facelift. It's kind of like the family practice with a scalpel. So getting back to Middle Easterners, very, very, very important to understand and talk to the patient, especially when you have a spectrum of change, where you have the thicker skin, you have the thinner skin, and every millimeter, half millimeter change you make can translate to imbalance in the nose and face. You got to have a conversation with the patient, and in this case, often the mom. The dad usually just kind of looks, stares you down, sometimes gives you a little bit of a, how much are you charging for this kind of look. But for the mom, she's really involved and sometimes has questions, occasionally asks about her face and brow lift more than the teenager, because she's done, she's on her phone, she's like, let's just do this. So it's very interesting, fascinating. It's part of the side jobs of my job that I like. So the Middle Eastern nose, very, very important to do nasofacial balance. Some people want a little bit of a reduction. Some people want to maintain a little bit of the hump and the prominence. Some people want a little bit of a curvature. Some people want a fair amount of curvature. Now, this gets me to the next point. You can see in these textbooks that I write a lot in the beginning of the chapters on the nasofacial balance, the measurements, the support. You can look even in this chapter. I paid homage to someone dear and near to my heart, Cyrus the Great, who was one of the probably the best leaders in the history of the world. Why? Because when he conquered somewhere, he wasn't even conquering. He was providing a better life for them. They dropped their swords down, and it was an easy fight. So a very brilliant guy. Came up with the first Bill of Human Rights in history, actually. So I always digress when it comes to Persians. Now, when we go back to the Middle Eastern nose, very, very important to not overdo it. When you overdo a nose and you do extra or you do too much, it might look good on Instagram because the transformation for that nose is so dramatic, but it does not look good in a year or two. You have the tip being too far forward. It tends to not look human. And that's one of the key things is this isn't even just about nasofacial balance. This is about humanness and being able to do the keep them guessing thing. Now, occasionally, I will sculpt the tip and do certain things for someone because they're very specific about a designer or couture, very sculpted type of nose. And in those situations, I have a conversation with the patient and I say, these are the risks. Cartilage becomes visible over time, so you have to be very careful. We don't want to do too much. And on that topic, what I'd love to do is introduce my colleague, who's my junior associate in the practice. He's seen me do a lot of rhinoplasties. We share our thoughts. We look at things together. And I'm going to bring him on to talk about first before anything, because he's a little younger than me. He has a little access to people that are a little bit younger. He may have a good pulse on how this around the world is perceived when these noses look so artificial, quote unquote, the Barbie nose, these kind of doll-like noses. I think it's dangerous territory. We're kind of going backwards to the 80s where we used to do these reduction noses, weaken the nose, weaken the cartilage, remove too much, over-rotate the tip. Looks really cool on Instagram, but over time would not look good, and those are very challenging to revise. Why? Because the cartilage frame ratio is a term I coined a long time ago when I lecture on this topic around the world. Cartilage tip ratio matters. And as you have cartilage pushing, just like you can have an implant in your breast that's too big, the skin over it thins out over time. And that causes visibility issues, exaggeration to the contours of your nose. You lose all what we call racial congruity. We don't know what you are. You could be from Mercury, Mars, Venus. Is Aquarius an island? Is Aquarius a planet? No, that's a zodiac sign. We should have a planet called Aquarius. On that note, I'm going to bring on Dr. Neil Vranis, and we're going to talk about this craze right now and end with what do we do for patients who are traveling around the world or who come to us and want these little tiny Barbie noses. Forget all ethnic rhinoplasty topics we just talked about. How do we talk to those patients? Okay, so let's talk about this. Now, you can travel to any country you want. There's plenty of countries right now that do phenomenal work. It's up to you and whoever your advisors are to find the right surgeon. But let me tell you, if you're traveling through customs with a Barbie nose, that's not a good thing. The main thing you should be traveling through customs with is a Barbie doll to bring back your daughter from a trip. If it's on your face, that could require major reconstruction, rib cartilage graft, possibly from your own ribs. And if you've had that nose for a very long time, possibly bringing in skin from somewhere else. So Neil, Dr. Vranis, what is your thought on how we've kind of gone back towards these overdone noses that look good on the gram for a week or two, are a dramatic change, so it looks like a flex, but require people to come to me and you and get them revised?
I think there's an element of wow shock factor, right? A lot of, no matter what the industry is, people are looking for the next clickbait, the next shock and things like that. And so taking this massive nose and turning it into a tiny little Barbie nose, big shock factor. You have a chance of going viral. And then next thing you know is your business, your practice takes off. So I understand the motivation behind it. The problem is like kind of what you alluded to, is that making the nose too small, it compromises the functionality of the nose, which is to breathe. And so if you lack support, sure, it might look good on the table, it might look good for 6 months, a year even, but then it starts collapsing in and then you have big problems, because to make a nose smaller is easy. To make a nose bigger is really hard. Yeah. Or to make it the right size and shape after it's being too small is really difficult. Yeah. You need large pieces of cartilage. You sometimes need rib cartilage graft. You might need skin. You might need ear composite cartilage for the internal lining to expand that part of it. And so you're dealing with a massive reconstruction. It's an aesthetic reconstruction, but it is a reconstruction.
Yeah. I mean, you hit the nail on the head, or you hit the nasal tip on the tip, the nose on the, I don't know. You hit it right on the nose. The thing is that when you do a rhinoplasty like that, the skin is thin. And when your skin is thin, we need pieces of cartilage, but guess what happens? Every single piece of cartilage we put in there could become visible in the future. And sometimes we have to put it in places it shouldn't really be so you can breathe. The challenge, the real flex for me as a rhinoplasty expert that's now done probably 5,000 noses, is that you make a nose look aesthetically pleasing, but you do invisible changes internally to help the breathing or prevent it to get better. We both have had issues, though, where we're trying to hit a home run on the aesthetics of the nose. Someone comes back and the muscles that you twitch your nose with, that you naturally, your nose knows instinctively to dilate when you inhale, when you're working out, when you're breathing heavy. Sometimes I feel like people need to relearn how to breathe right, especially during the healing phase, but even long term. So you should know that when you get a rhinoplasty, even in expert hands like ours, you might compromise your nasal breathing a little bit. Now, we always try not to, but sometimes it's part of it. And sometimes there's that compromise. I've had patients, I don't know if you've had them tell you, like, I don't care how it looks. I care how it looks. I don't care if I can breathe. And I'm like, come on. First of all, I don't want to directly cause that. Now, if it happens by accident or down the line, if those muscles get stiff and in your genetics, your anatomical makeup tend to not become flexible again and lose their function or whatever, it's not necessarily our fault, but it's just like when you change the anatomy in somewhere, even like a tummy tuck, some people have that rigid line that you can feel that's like rigid fat underneath. Some people, it just feels soft, like, babies, what. So what do you tell patients that are like, I don't care how I breathe, I just want it to look like this?
I mean, I think then you start to really assess the psychology of the patient, right? Like, what is more important? If some person told you, I don't care about, breathing, that's like one of the biggest signs of life.
Yeah.
And if they're willing to compromise that just for an aesthetic look, I think you have to take a step back and ask yourself, is this really the person that I want to operate on? Or is this the opportunity to educate them and say, listen, sure, we might affect breathing a small degree. You may need, to take a deep breath after running 5 miles and not 6 miles.
And you are an athlete, so you know
Right.
how important breathing is, not only to life, just day-to-day activities as you get older, too.
And snoring, sleep, and then it affects your sleep. If you're not breathing well during your sleep, it affects your sleep.
Yeah.
I think that's one of the reasons of hypertension is inadequate breathing when you sleep. Your blood pressure.
Hypertension is high blood pressure.
Your blood pressure goes up, exactly. And then, we're sleeping a third of our days.
Yeah.
That's a lot of hours in a day that we're spending sleeping. And so it really affects your overall health.
Mm-hmm.
And so to compromise that for an aesthetic result, I think is a little much.
Yeah. I think,
it's different to compromise a little bit, like you're talking about, where no, they're breathing fine. It's just if they do
notice
this,
in certain circumstances,
if they do this, and it's dry outside and the allergy season, then I can't breathe for a day or two. That's different.
Yeah. I sometimes tell people, even with me, I have actually a very deviated septum. So I could breathe normal. Like if I'm in yoga or I'm doing meditation, I breathe like this. Or if I'm stressed out, whatever, I might go. So that's a big difference. I didn't have a rhinoplasty. I have a natural septal deviation. You need to learn how to breathe right. So I actually tell that to patients before their rhinoplasty, that you have to learn that like proper breathing is not, and even when you are running, jogging, you're doing athletics, you're doing strenuous activity, you need to learn how to breathe to be made. The elite athletes, not all of them get septoplasties. They just have nasal deviations. I'm sure a lot of NFL players have deviations. When they get hit, it gets even worse. But they're still on their game. They're still breaking records. So you got to just understand that life is unpredictable. You have to work with what you're dealt with genetically. And then after surgery, you come to experts like Neil and I, and you do proper surgery, you should be fine. And if not, we'll fix it for you. There's so many options. There's some non-surgical options, and there's other options. Now, the important thing I think here to bring up is, I don't know if you agree with this, but I think you do. There's no reason in the world somebody should be operating on your nose if they don't know how to correct your breathing also inside. Now, Neil and I don't do sinus surgery. I have ear, nose, throat, otolaryngology colleagues that's kind of all they do, and I bring them in and we work sinuses, septum, sometimes together. But your septum, your turbinates, the internal anatomy, the integrity of your lower lateral cartilage, your tripod, mid-vault frame, your integrity. That is our expertise. You should not be doing rhinoplasty as a surgeon if you don't know how to do that.
Completely agree. I mean, an analogy comes to mind is being a contractor at a house. You have to know how to do the basics, the plumbing, the electrical, the walls. Sure, you might need to bring in a tile expert if someone wants, Italian
You love
marble.
that house remodel. Where did you learn that from?
You told me about like the house coming down. It makes sense for people, and it's something that most people, I think, can relate to, or they have a direct experience with a little remodel, or they're buying a house or shopping for a house. They've thought about these things. And I think when you put it that way, they're kind of like, oh, wait, that actually makes sense.
Yeah. I mean, I also use the house analogy a lot for remodel because I remodeled my own house. When you get a rhinoplasty, it's like you're remodeling something. When you get a facelift, brow lift, you're remodeling, you're rebuilding, you're moving things around, hopefully in expert hands like ours. If something isn't perfectly right, it might be one aspect. It might be this portion of one nostril. It might be that this nostril comes in a little differently. It might be that you naturally are asymmetric and your nostrils are like this to begin with. Now that your tip's not drooping down, you can actually see it more. And we're trained to recognize that and prevent that in the operating room, but we can't reverse and fix every single thing in asymmetry. We do our best, but it doesn't mean the nose job, the rhinoplasty, was a complete failure. Revisions are a whole nother topic. We're going to have a segment, an episode on just revision rhinoplasty, what to expect. The patient's required to be a revision rhinoplasty patient is really important. But in general, don't throw the baby out with the bathwater is what they say, right? Like, you don't say, oh, I just realized I want the garage to look different. We need to change the garage door now, and we got to add a bathroom in that corner. You don't go to a new a new builder, a new general contractor, hire a whole new team, tear down the house, rebuild the whole house because you're adding a bathroom in one room. Trust your original surgeon, trust the process, be patient. And on that note, I want to talk a little bit about recovery in general in rhinoplasty. Our next episode is actually going to talk about recovery in general and how your whole body, mindset, spirituality, circle of support you have, all that matters in healing. But for rhinoplasty specifically, I've taught you a few things. You've seen what works. What are some of the key things with sprays? How long do you think things take? What do you think?
I think internal nasal saline sprays and a little bit of mupirocin, bacitracin, neosporin, something in the antibacterial, a little bit for the first couple weeks, maybe even 2 months even. Saline sprays a little longer because, like you alluded to, the internal mucosa, the muscles on the inside need to relearn, hey, today's a dry day. I need to give a little bit more moisture. Oh, today's a humid day, come back. It doesn't need to be as, I think, moist. It doesn't have to produce that mucin.
Yeah.
And so it needs to relearn that. And in the meantime, you have to coach it along and say, okay, here's a little extra spray while it learns. It's like kind of teaching a toddler how to walk.
Yeah.
You kind of have to give it a little support, sometimes some training wheels before the bicycle. Biofeedback, right. So I think that process does last 6 to 9 months. That's a longer process.
Yeah.
And even though on the outside it looks good, they walk into a dinner party, a function, and they're like, oh, this is, something looks different about you. You look good. Oh, you're looking really, new haircut, keep them guessing.
Yeah.
And they kind of feel good about themselves because they know they've got a nice nose job and it just looks really nice. But internally, they still need to go to the bathroom and spray every now and then, maybe.
Yeah. I mean, the conversation I have with people, I try to have it beforehand. My consultants, my patient coordinators have this conversation with them beforehand. We know, statistically speaking, people listen to 20% of what their surgeon tells them, their doctor tells them. So we reiterate it. It's in the paperwork. It's on my Instagram. It's on YouTube. Watch this podcast. We may make this podcast mandatory to view before your rhinoplasty. But honestly, you have to do all these things because if you don't even get a rhinoplasty, if you don't even have a nose job, you should be doing saline sprays all the time. The Indian culture, we talked about Shushruta 500 BC. The Indian culture does a neti pot, which is a little aggressive because of the high pressure, but there's also Neilmed, this kind of spray bottle, which is my favorite. You put in a packet of salt, you go like this on one side, and it comes out the other. You're irrigating, you're doing good nasal hygiene. You can do that without a rhinoplasty. If you're an elite athlete, all the elite athletes out there watching this, which is not that many probably.
Not yet,
yeah,
they will.
Yes. Come for your rhinoplasty in the off season. You will perform better. Don't tell your coach. But the main thing is you have to do saline spray all the time. nose job or not. So that's number one.
Speaking of the NFL, half the guys on the sideline are wearing the nasal strips to like open up the internal valve. Right? So they figured out, hey, I need more airflow going.
And there's people
way.
that wear cones when they sleep at night. Sometimes I have my patients do that. I think, if you think about it, that's one way we do it. The nasal valve support, there's cartilage as we put, because you can't walk around with a nasal strip all your life. But sometimes post-operatively, to train and help the nose heal how it should, we do the saline sprays. Sometimes I'll put people on Flonase or a stronger internal steroid to calm things down. The mupirocin ointment, the lubricant. When you do surgery on the human body, it knows. It has memory. It knows there's been an insult, an injury. There's been a little bit of micro trauma. Hopefully, in this case, little trauma. That's why in Flash Recovery Breast Aug, which Neil also knows how to do, we're sneaking that implant in and coming out quick. So your body is almost like, wait, what happened? You don't want to be delaying in a long surgery. You don't want to do breast augmentation for 3 hours with a breast implant, everything exposed to thin air, putting in a foreign object. That's why knee replacements, orthopedic surgeons, the flexors don't take that long to do it. They do it accurately. You don't want your knee joint exposed to the air, no matter how sterile the environment is, for too long. Same thing with rhinoplasty. You want to go in, do your job, and then afterwards, your body knows something's happened. So the nerves go to sleep for a little while. The muscles are tight. They don't function right. Just like after a hard training session, before and after you train, you should do flexibility. You should do mobility exercises to retrain your fascia and everything how to be. Same thing with rhinoplasty. You want to do breathing exercises. You want to help it along with the sprays, the lubricants, nasal stents, breathe right strips, whatever it takes to allow it to heal. There's taping we like to do. You have all your patients tape?
All of them for the first 3 months.
Yeah. And on and off, not
nights, or maybe 4 nights a week. And that's what I tell them. It's gradual. You start with every day, every night. After we take out the main splint for the next week, it's every night. Then they can maybe do once every 2 weeks. They take a night off if they're having fun, they're at an event or with like a significant other. They don't want to tape that night. That's fine.
Yeah.
But then they start realizing, oh wait, the day after I didn't tape, it got a little more swollen. So then they tape. They're like, oh wow, it helped. And then they start learning and they say, okay, I'm going to tape maybe 3 days a week, 3 nights a week. And then they're like, wait, but on the night that it's super swollen, I'm going to tape that night. And
or right up until an event.
Right. It slowly kind of weans off.
I'll never forget, there was one of my first celebrity patients who I think is one of the very few, if not the only one, that admitted to her rhinoplasty. Did a red carpet like 4 weeks after her nose job. And I'm like, oh, she was still swollen, super tight, but she looked pretty good. People commented. But honestly, I saw photos of her just another month after that, and it looked like just seamless. You have to be super patient with your rhinoplasty result. You can do a little less to the nose and probably have a quicker recovery. Or you can also game the system like some surgeons do and take your splint with you home, come back 3 weeks in the office, remove it as if it's your first reveal. That's pretty shady and manipulative, and we don't do that. I think when we try and do early results or in the operating room, operating room, it's obvious, it's immediate. But when it's afterwards, I think every surgeon should say, this is day 7, day 21, this is a 3-month result. I think it's so important for your surgeon to be honest with you about that. So when you're looking, you know what to expect, because it's very rare to have 0 bruising 6-7 days after rhinoplasty where you've brought your bones in a little bit. It's just the nature of the game. So being patient with your rhinoplasty result is key. Going to an expert that works on the inside and knows how to work with your nose, no matter what part of the world you come, no matter what ethnic background you checked on 23andMe, which you shouldn't be doing, Ancestry.com, all those, I never did that. I think I know where I'm from. But regardless, we're trained to see that. We've worked with different skin, different cartilages from all over the world. We have this book here that I've trained and taught my colleagues about. These are some of the chapters. Neil actually helped me write one of them in there, and he's actually assisted me when he was a fellow back in the day on these 2 key papers. These papers, one of them was selected as the pick of the month or pick of the week.
Pick of the month.
Pick of the month.
It was the cover of the issue, and then it was also the Journal Club topic or the paper that they talked about for the month. So that was really cool.
Yeah, what a huge, huge honor. Honestly, it probably would never have gotten written if Neil didn't come in and finally do it. I remember sitting with him at Earth Cafe at like 8 p.m. It was dark, like not drinking coffee, just water and just pounding through, making the changes, submitted it. It's not easy to get a scientific publication published and there forever, because that's lifelong. Like my great-great-great-granddaughter, grandson can come one day,
It's always there.
go to UCLA Medical Library, dust it off the shelf. Hopefully we'll still have journals and books, because I used to do that in residency. I used to go back and look at Jack Joseph's book from the 1930s, look at Harold Gillies from England in his reconstructions, his first early cleft lip repairs. History is so important, like knowing where you come from. So with that, I'll let you have the final words. Ethnic rhinoplasty, not the best term. That's why we called it global rhinoplasty. If you are truly a rhinoplasty expert, you should be able to know how to operate on any nose that comes in through your door. Hopefully you have a good conversation with the patient, their whole kin and family if they end up coming in with them, and letting the patient know to be relaxed, to chill, do all the things we say, trust the process. It may take longer in you, or you may look good with makeup 3 weeks later. Let's end with, in general, what timeline do you tell patients? I'll say what I say and you say what you say. I tell most of my rhinoplasty patients, now the more we do to the nose, the longer it takes to recover and the longer it takes to be soft. In general, your smile and the stiffness and that feeling of things are tight can take anywhere from 3 weeks to 12 weeks. 3 months is kind of the magic timeline for all plastic surgery, where you're pretty much good to go. You could start wearing a bikini for body surgery. You could go bra shopping. You could start flexing your nose without makeup, and it should be soft. You should be able to start breathing better. But sometimes it happens sooner. Sometimes I have people come in 4 weeks, and I think it's 3 months, and they look great. A lot of it's based on your genetics. We can't control that much what you do and what happens with your genetics when you leave our operating room. Those are kind of the general timelines. And then for revisions, I know people like Rick Davis and others who don't even want to consult with you until it's been about 1.5 to 2 years after your revision. Revisions take even longer. You got to really be a patient to have your nose done. What do you tell people?
I agree. I think at a month you're of a primary rhinoplasty, you can go to an event with a little bit of makeup. People wouldn't know, and they'd say, okay, like it looks good. You and I will know it's still swollen at that point. At 3 months, we start to get a glimpse as to what it looks like. And most patients will say, I have my good days and my bad days. And the good days look really good. They're like, oh, I can see the tip come in. Mm-hmm. And then on the swollen days, they're kind of like, wow, it's starting to look like a small potato again. And those fluctuations happen. At 9 months, I think those fluctuations are very minimal, in which case they almost every day they kind of see their nice nose again. But for revisions, I think it's 1.5 to 2 years.
Yes.
Of those fluctuations. I think you'll get glimpses of it, even with revisions at 9 months, 6 months, 12 months. They'll say, oh, wow, I had a really good week. Yeah. But then I went flying, I did this, I ate sushi every day, and it swelled up again. And they have to tape, for the next week to get it back down. So it's almost akin to like bull riding, where it's not smooth sailing every day, but you have the surgeon is the bull rider and has to tell you, okay, now you tape, now you do Flonase, now you do this, now you do that. And you're kind of seeing what they're experiencing using your experience and your training where you came from. And I'm lucky enough to have very good mentors. And your experience is my experience. I hear your stories and say, oh, wow, like when you did this, this worked. I say, okay, like let's try this. And my patients benefit because of all the experience you've had. Yeah. I've had some of my own now, and I'm very fortunate. But I'm even more fortunate I get to rely on you.
Thanks. Yeah, we bounce stuff off each other. He's my emotional support sometimes.
And one time you came to me with a case, and that day I'll never forget. It was a breast case, and you said, what would you do for this? And I was like, you're actually asking me.
Yeah. It's, it's fun because really nice. It's a little bit of a test. It's like when you're dating and stuff too. You want to test people out. But the thing is, with rhinoplasty specifically, I think out of all plastic surgery, and we know colleagues of ours that did rhinoplasty for years and abandoned it. Mm-hmm. The patient expectation rates right now is so hard. With selfies, I mean, people come in with 300 photos. They show me 1 out of 300. They're like, my nose didn't look good here. But the thing is, with the selfie generation and all these apps and filters, the unrealisticness, flying to other countries, getting Barbie noses, it's really difficult. We don't have the time, to be honest with you, to devote to you on counseling, all that. Come in prepared and then ask your questions. We will counsel you. We'll support you. You should have at least 2 to 3 visits with your surgeon, whether it's Zoom, pre-op, etc. Speak to the coordinators. My coordinators are very knowledgeable. One of them actually had rhinoplasty by me 10 years ago or something like that. So I think it's important to be a little extra patient if you're going to get your nose done, because you know what? If it becomes more difficult to do this surgery because patients are not patient and expectations are too unrealistic, rhinoplasty surgeons are going to be, dying
Extinct.
off. It's going to be an extinct art. I know a lot of surgeons that don't do revisions, but they only do primaries. I think that's not fair. If you do primary rhinoplasty, you should know how to revise your own nose and not send it out. You should be able to do some revisions. And I think you have to just be fair to your surgeon. It's a sacred doctor-patient relationship to be fair, to be communicative, not over-communicative, and trust the process. Once a year and a half has passed, and you feel like there's something that needs to be done, the time is right. Sometimes little tweaks can be done around a year or earlier. I've done minor tweaks at around 6 to 9 months, minor. But in general, you got to wait about a year. From even some little touch-up, you got to wait another year. And so it's a complicated game. So talk to your surgeon, stick with it, be patient. Dr. Vranis, so proud and so happy you were able to make it to give your 2 cents. Any final words?
No, I think we covered it all. And watch these YouTubes and podcasts. I think they're
might
very
make it
informative.
mandatory.
I think you should.
Yeah. So watch this one if you're going to have rhinoplasty. We'll probably send it to you, have your coordinator send you this in the link. And good luck to you in all your aesthetic plastic surgery, health, and wellness endeavors.
Awesome.
Solid.
That was good.